O malungsol be sado malungsol marbe klado loko lorengs. Ngaka waya blado nga Mr. Talam sa angkla Waymine Towai nga ko Ngirachsau Mekoll nemo. Direct chairman ng Tigid del Palau Healthcare Coalition. Rekutal taal Mr. Talam sa bukin introduce tigil members ng atyang. Domo urabay si chairman ng Tal Coalition ng anya Chief of Fire Mr. Godwin Philip. Of course ng anya Dr. Mekoll, which everybody knows already. Ng anya Miss Maireng Sengebau, ng Executive Director ng Palau Red Cross Society. Direct ng anya malto ko betlok siya kagid ng atyang ilalsils. Ilek mo ngusel ti album sa Miss Kayla mong fire mo o sokartir Kayla.
Malungit silver ako'y nga kangkli ka Kayla Rebluud nga ka-order of fire as an EMT. Maobanggedal amlelobong kamamar ilanga nga niya Edward Caballer nga paramedic ra State of Hawaii. Direct Professor Capulani Community College al nga ra Hawaii. Direct nga niya obang kamam Dr. Dever. Of course Chief nga kara Godwin Philip.
Tiyede Mr. Talam stigel wata tuto ka ulto iltir la kegid lokul l'activities lagi damo al week kita mendengek mo last week amle week ra law enforcement madman nga sulir lokul police al week aduk mo focus sa segid emergency medical services al week di bok ka di briefly introduce sa segid al week tal week atim ringi beyond the call cell after dengwa ra emergency domo real mandeng sel ko ramen dorungi education Tuesday mo tukora safety. Second Wednesday emergency medical services for children day. Thursday save a life. Again ang anya in-depth activities mo do sa. Ya Friday ang aning second emergency medical services recognition. Kunit teknutal ala kukpok kung sa Dr. Dever malukora maskit sila kora aldo mga tabil karang mlawa karang maartagid Ngirachsau Mekoll EMS Caballer belang. On to you, Dr. Dever.
Oi, Manuel Suela bekla athang naga Ngirachsau Mekoll mulko takora abelao esolak mospa takora na Bharat. Chairman Kamamasal tel this is a wonderful celebration, and I'm the historian. That's why I'm here, an old-timer. I was director of the Bureau of Hospital and Clinical Services from 1999 to 2009. And during that period, we were able to capture what was called a hospital preparedness grant. And one of our main goals was to see if we could bridge the divide between the Ministry of Health and the Bureau of Public Safety and develop a emergency medical services system. We started off with training and did our best to train the ambulance drivers and skill them up. Over the years, we even sent some to the U.S. For training, and one of those people that we sent is actually now the chief of fire. So what that did is prepared the way for the bill that was passed in 2017 into a law, Bill RPL 10-9, which basically set up the mandatory minimum equipment and training needs to run the ambulance system in Palau. So it really is a roadmap for the development of EMS in Palau. And the Vice President then really took a leadership role in developing the EMS committee. Many of the stakeholders came together, which included the Ministry of Health and the Bureau of Public Safety and Red Cross and others, to implement the laws, which had very stepwise mandatory requirements of both equipment for the ambulances, as well as the minimal training requirements for the EMS actors. So at any rate, it's this is really this week a celebration. The fact that after a decade of intense activity, we were ready to come together and through a law and implement the EMS system in Palau. Thank you.
Madam Saul, Dr. Deber, Mr. Talam say lang of course ital week from Sunday mo Friday there's a lot of activities sa calendar ka ma'am. Makuligit tadik bukas kami sa Kayla multiple control the calendar ilang week. Thank you.
Sulang Chairman. So, kada mo el Monday tutaw agi ko na talk show ra ngarel belaw le nga kama Dr. YB ma Marchi ra ngirmidol ma Wanranurs ma Chico ulbang kama sa tutaw. Tuesday, Wednesday, Thursday ang nga classes mga Kayla ma Nathan one ra instructor dili kal firefighter agi mo hold the classes sila stop the bleed dili kal volunteer wa Dr. YB ang nga sel injury and safety prevention ka kilala car seat ma promote wa car seat ma child restraints moringira PICRC altalsils Sel Friday, ang ringi sa ida dinner reception el lo sa niya chairman agi dili kal hospital ma la pulis la nominate Arterul Adrage Lurior as EMS Provider of the Year Award el moringi mo award sa ida dinner reception makti mongul sa Chigo mandi malmutal smoothie stop the bleed o ay stri dito ko mong raw nga teletele lang nga mal important sulang.
Sulang Kayla. So like Kayla said, this week we're going to be doing a lot of Stop the Bleed classes. And Stop the Bleed program has been a national program to basically get healthcare providers, get civilians, get everyone familiar with the actions that it takes to help save someone's life. So something as simple as direct pressure or utilizing of tourniquets after some training has been shown to prove increase in survivability of these traumatic type injuries. And in across the U.S. there's been a lot of trauma related to shootings and vehicular damage. So what we find is that the more people we can get trained in the Stop the Bleed program, civilians especially, are helping save these people's lives before EMS can get to the scene. What we're seeing is that the survivability from extremity injuries and wound injuries, just by doing simple things like stopping bleeding, are showing remarkable increases in survivability. So the plan this week is on Tuesday, Wednesday, and Thursday. We're having multiple classes at multiple locations, and hopefully we can get some more participation for people to come out and really learn this real simple skill that makes a really big impact on someone's life. Thank you.
Thank you, Chico. Agagi dagel Lokorambo o highlight the activities al week. Sel stop the bleed Mr. Talam sa it's a step up from self first aid and CPR. On the subject of first aid and CPR kung taltalek askra Miss Director Sengebau mulukpol duigal part with course.
Sulang Chairman. Kamamal Red Cross kuradi ang malmasaw la toktang mangkal adadal mlara Hawaii mel masaw dar segi do lasing makarang awada tomera igarase di kamama Red Cross amlo maktub alurele la agirel lol ngasera rogu il obis rakabalmenta makamama me soy seperti ang aldime melisi aureli rar adra fire ma EMS EMTs ma adra nemo Raigel guk urela mal sa amal wagim concentrate rar adra blue. Mga kamel wak kura di oy sila sing mal ngegidal adadal mle waset ay gagidal training lo mu rak ongeru lurior ongedem ongewang malungil. Hindi direct rasok lo ay sila se tirigagidal blalunga first ay dal direct kabol si irele kong letiang awal step up pangwal continuation. Hindi sel malwa kora direct rasokal ngul me erera way al sandel girela emergency medical services wi kawase kadamna ngal tangat lang nga fara 911 ma EMT misel dokol hindi arogul to ko yang nga igel do wadom kadong lasing preventable ang se edal di nga rabla orior mesay gida ku kurela mar other Red Cross la say agi sa amel guk mas kami way gel mal basic el first aid ma CPR man si ul nga rabla mestrir adam yun nam tamal ma tulungal egol ranan 11 mate ko nga raad mang mal nga ringi obis ra Red Cross komdigol sellable through el adia a training at top de legor sel nga ringi mang wal bekal sil sel kadam la mesat batogol ngal gedel matamal mar adadal ramos maroku yake batogol nya wal blel korasab edel kukora prevent ruli mang modia kal happen ending modia mang ay gagi dagi metmul wagi di molisi au release tirgagi darwa ke ilama ar adra farm ar adra nemo hospital magomal masawrat te alle kom di gola obis Red Cross.
Mr. Talams el stop to bleed akatengel el merbelaw agadiyak el kakarngi amal kloludo de dollar experts el meme tolsis akle makamle uldas wa coalition na lalak mas kahalle bad ko tames ringi traki del first responders babuk pod modu ringi mesel dungul dwal out tingil mora public ma community el nganya questions mangarang first responders asebe el hensi malu bet address agigid el concerns at kilel tekil program o etia ilang open namang nganya ko ragir Mr. Talam solo pelu en sepel entertain la.
Sula women sendra se stop the bleed program. En belgolak na se gom stop ras ra adam lam tamal lemra la rasering. Why say?
Oh, yung telgibel more in depth than that. Let me give it to Chico. The question is the stop the bleed program. Does that literally mean just stopping the bleed and that's it?
That's a great question. So there's many things that happen when someone's bleeding. And the sooner we can stop the bleeding process, the better chance of survival that this person will have. But that's only the first step. The first step is to actually locate where the bleed is, where the wound is, whether it's an extremity, whether it's within a joint or on the trunk. Find it, stop it, and once that bleeding has been stopped, then the next couple of steps we'll teach you are things like keeping the person warm, laying them down. Little things like this actually make a big impact, because at the cellular level, a lot of things are happening, things that we don't really see. But doing things like putting a blanket over them to help retain their body temperature will help them clot faster internally. By stopping the bleeding quickly and maintaining the body temperature is probably the most important thing that we can do for them. Once the ambulance arrives on the scene, they'll take over and they'll continue with the shock management therapies, including things like oxygenation and if they need to, IV fluids and things of that nature in the emergency room. But the concept of stopping the bleed is actually that. It's looking at an extremity injury that is arterial in nature and spurting. We know you only have a moment to before you bleed out. So addressing that quickly, putting a tourniquet on that and holding it into place and making sure that that has stopped completely will make a big difference. The same thing when it's a chest wound or a large gaping hole. By impacting some trauma dressings into that will make a big difference right away. So it not only is stopping the bleeding, but it's also the beginning of the shock management phase.
Sila women elagel class el molgot mo manira Tuesday, Wednesday, Thursday Komla selector adal mura gigi the class tiagi the program ra stop the bleed the program.
Why say article participants halakum sa Kayla Melbol Saudi but already predetermined.
So, Chairman. So, again, classes ra 21, 22, ma 23. Agim le partner uploadan tier adra PCAA. Tia sele emergency medical services for children. Agi ko ra di oban tier gigi de ko le partner loban tier sensei ra PCAA. Agil head start. Ko le master tier gigi de to ra op tier rangal ka. Agi master tier say ko le bol merek say sel Friday o sel ko may sel Thursday. Kanya open or still afternoon di lagi ulam daso se amo kanya bebir sensei dire kal soril me malara class magidim le open rin mortir after tiang ya kama makuk mo open rin more public mo sobrir adan me apply malara me junior class sa stop tabli.
Tula gela ngariya head start tragel bebir Rebluud babel davel. Tira telgivel wal roidra medical services or mlani atelil gora invited tirgel sincere start tragel me participate tiagidel.
Why say Dr. Mr. Talam se tukang daw laban trim makadidi mo doctor bitla. Sel mlora PCAA mortal PCA rogir magel lokul head start provide center sa invited the medical training.
Malmsurang Mr. Waymine tiala katanya del momdanglil program le seguida la el tendas na namral dire le mang mo require tirgelado ng ambulance el girel gorangaria telgibel medical klamdangir tira ar adal matamal elang ngaria gora specialized el equipment el gora obangal tiagi the program mla mo sebel ng ambulance malube como laba first responders
Malso mamagal gere Mr. Trump sala kung nutum sa kailang kaya tirgit mo. So dice.
Sila. So sige del care. Ngayon scope of practice lulu siriya tilgalwa chigo mar tokta. Se mo ngania signing ringi tadi ka momit tilgal atra committee mo sign sige del scope of practice. Se kalmun sa chigo mang muten mo smoothie mo ramal moktir sige del scope of practice.
So lang. Scope of practice details what the EMT provider is allowed to do and how they're supposed to do it. And these are some guidelines that they will be signing into law that will give them a structure as to what is expected from the EMTs on the ambulance. So not only is it structure as to what their standing orders are for certain situations, but it also guides them in how to treat patients suffering from different illnesses or injuries. These are guidelines that every EMS system across the country and across the U.S. have, and these are the guidelines that build upon how we not only treat the person in the immediate stages, but also can translate that to the receiving facility at the hospital so that they know what minimal was expected for this patient suffering from a medical or traumatic illness. The scope of practice also will dictate what they can and cannot do. So if someone calls 911 and is visiting from another country and expects something different, well, our scope of practice will minimize the level of provider treatment that they can do as EMTs. This keeps them protected under their law, under their scope of practice, so that they know what they're supposed to do and that they don't get coerced into doing things that they're not supposed to do, which can cause injury if not properly trained. So the scope of practice really encompasses and gives them the guidelines on exactly what's expected of them as emergency medical technicians.
Chico, this is Dr. Dever again. Chico, could you say something about the training and credentialing of the EMT individuals here in Palau? So our listeners will get an idea of their level of training.
Sure. Thank you, Dr. Dever. Our emergency medical technician training, or EMT training, is follows the national standards, or the National Association or National Registry of Emergency Medical Technicians, the United States standards, correct. And these standards have minimal requirements in terms of learning didactic materials, practicing of skills, and evaluation and testing. What we did here in Palau is we developed a program that was specific for the community here in a way that was easily addressed and digested. And not only were we able to successfully provide EMT programs, but we were also able to create a sustainability piece by training two firefighters, Kayla Rebluud and Nathan Aldabay, to become EMS instructors. And in doing so, what we do is we create an environment of sustainability where whenever there is a need for additional training, it can be done locally instead of having to reach out to other agencies or entities to come and do the training for them. So the training required approximately 100 hours of learning in the classroom, approximately 75 hours of skills training, and we culminated with some examinations. They had module examinations, they had a midterm examination, and at the very end, a final examination. Everyone had to pass with the final examination in order to be licensed as an emergency medical technician.
And before we let you go, in RPL 10-9, there's language about developing within the chain of command in the Bureau of Public Safety a medical supervisor for the EMS system. Can you say, because ongoing daily supervision is key to keeping up skills. Maybe you could comment on that.
Yeah, sure. That the medical supervisor or the EMS supervisor will be someone who oversees the provisions of EMS care and training. One of the things that we want to ensure is that everything that they've learned does not get lost with time. So we want to ensure continuity. We want to ensure that they have maintaining competencies in what they've learned and what they've trained. So the EMS supervisor, the medical supervisor, will on a regular basis review all of their documentation of their calls that they've gone on, make sure that they're meeting the minimum qualifications, that they are in line with the scope of practice and treatment protocols. They will perform quality assurance reviews and set up a quality improvement plan for anyone that sort of kind of falls a little deficient. And they will also help create continuing medical education programs. So currently, Kayla and Nathan are doing this locally at the firehouse, where they're providing training on a monthly basis to every shift, and ensuring that they remember things like how to take vital signs, how to do a proper patient assessment, how to do splinting, how to properly diagnose a patient or review pathophysiology. And this is very important for maintaining your credentials, because every 2 years they want to renew their license, and in doing so you'll have to meet minimum requirements in terms of continuing medical education credits. And this will ensure that everyone has gone through training on a regular basis to maintain competencies.
Can I make a follow-up question on that? So, is there a current training for the fire personnel that are going to be certified?
So we completed training August 2018. We completed training. Actually, let's go back a little bit. In 2017, we did a refresher, an EMT refresher class, at which time we identified Kayla and Nathan to be EMS instructors. So in the spring of 2018, they came up to Honolulu They did one-on-one training with me. We also put them on the ambulances in City and County Honolulu so that they saw firsthand what is expected of EMTs. And then the last summer of 2018, we did the last EMT program, and Kayla and Nathan actually taught those classes. And by doing that, I was able to monitor them to ensure that the information being given was accurate, was provided in the method that was supposed to be done. And so that class graduated 9 additional firefighters who are now certified EMTs. I believe that there's going to be plans for another class coming up very soon with the new recruitment and a need for new firefighters that are coming on board. As per the law, anyone working in the back of the ambulance has to be certified as EMT. So there's definitely going to be another class coming on very soon.
You know, Dr. Dever mentioned something that is very important. That is spelled in the RPPL 10-9, that the supervisor needs to be a medical doctor in order to supervise this certified personnel. But right now the fire department is under the Bureau of Public Safety, who is headed by the director, who doesn't have the medical background to supervise this personnel. How would that fit or make this program successful?
So we have 2 levels of, we're going to have the, Kayla and Nathan are currently the firefighter supervisors, right now trainers, and they're conducting the training. What we're looking at creating is another, through the law RPPL 10-9, is to create a medical supervisor that will oversee the EMS system. And that can either be a physician or a nurse, or it could be a physician's assistant, someone who will have experience with quality assurance, quality improvement plans, and wherever they lie, whether it's in MOH or MOJ or BPS, that individual will help guide training, certification processes, will report to the ambulance committee on a regular basis to ensure that the complexity of the work that's being done is followed appropriately. So this is an individual that will have some say, but is not there on a day-to-day basis. That is being done locally within the fire department with the supervisors, the lieutenants, and the sergeants in the fire department right now. Kayla and Nathan will be ensuring that training that's needed locally at the stations are being done, but this would be someone above them that will oversee all the EMS services to make sure that everything's being done appropriately.
Mr. Talamas, thank you for that very important question. I helped write some of the language of the RPL 10-9. And if you read that very carefully, the medical supervisory language, it does not indicate the need that person be an MD doctor. So what Chico is talking about is actually the next step. But currently, one of the people that have been trained in Honolulu, they were also trained in supervisory skills, not only continuing professional development skills. So they can actually comply with the needs of the law itself right now. I agree with you, though, that there needs to be another kind of supervision, and that I know that I'll let Dr. Mekoll speak for the Ministry of Health, but I know that from my experience there, the Ministry of Health always stood by to provide the Bureau of Public Safety medical expertise and advice when needed. Maybe Dr. Mekoll would like to say a word about that.
Thank you, Dr. Dever.
Sula Dr. Dever. Sada Dr. Dever, the chairman cell licensure board of health professionals of Belau. Cell 10-9 the regal mandate licensure board the regal overseer tialurior. Mandial self mal the Ministry of Health MOC the regal ngari board health professionals el monitor already tigala. el alsil se tigarrogul EMT require malar se license se renew every 2 years. Renew regel se license require a certain number of hours ra training o ra skills ma rogul ngal mang even though dia ka medical director elang ending ngari ongoing supervision regal urior plus engal chigo mal willing mal di all merbelaw mang dia di blal certified tedre go through refresher course mangari el course ra long lela rerir e gira malangal tangat ngai da geilal tirgam la elevate ra skills still more se namos will trainer de monitor rerir.
So this coalition group here is like an implementing arm of 10-9. And I was wondering if there are specialized equipment that have been provided to these first responders now that they can...
Yeah, so to answer your question, we've trained the firefighters at the EMT level to ensure that they had the minimal training that's expected from them, including equipment. So one of the things we ensured was that the ambulances had automatic external defibrillators. And not only that they have AEDs that are life-saving, a piece of equipment, but that everyone was trained in it. So we ensured that all the firefighters were trained in CPR and that they learned how to use the AEDs, and that the AEDs were, the same on every ambulance. You could not have different kinds of, so everyone has to be trained the same way. Other specialized equipment include extrication equipment, splinting equipment, things to help stabilize fractures of the femur where they use a mechanical traction device. We've implemented tourniquets for stop the bleeding technique. So these are things that at minimal are needed on every ambulance. These are the specialized pieces of equipment that they use.
So while you're here, have you had a chance to review the ambulances here that are being used? Are they equipped with those basic equipments?
Oh, I'm glad you asked that. In fact, yesterday I stopped by the fire station in the morning and got to speak to the crews that were just coming on board and explain to them, what's going on, how do they like their new ambulances and their equipment. And I was very impressed on how they set up and organized the equipment. They were very happy. In fact, a review of some of their charting showed that they've used some of these specialized pieces of equipment. They had a patient who suffered a cardiac arrest, and they initiated CPR and used the AED. And on one occasion, they were able to successfully resuscitate the person. So they are using the equipment that they were trained in use. They're using the training really the way it's expected. So we are seeing some great outcomes from the training we're seeing.
Mr. Talamas, I just want to say something. Chico he's a very humble guy. He forgot to tell you how many ambulances he was able to manage being donated to the Republic of Palau.
So how many ambulances have you donated?
Thank you, Dr. Dever. So as of right now, we've donated 2 ambulances from Hawaii, and I may be able to work on getting 2 more delivered once I get a formal request. And so I try to do my part. And I remember a conversation I had when I first got here with Dr. Dever, who said, "If you're in for life." It's like the mafia down here. And I have to say that I am very humbled to be here and to be part of this lovely family that is Palau. And I see myself retiring here, and I just want to see what's best for the Republic here, and for people that come to visit here, and lovely, pristine Palau. I hold it dear and close to my heartstrings. So anything I can do to help, I find, it's a blessing that I'm able to do this. So
thank you very much for donating the ambulance. I had a last year I was taken by the ambulance from Babeldaw to Kuror. I had a hard time balancing myself on the cart inside the ambulance.
So, and that conversation actually came with having a discussion with Chief Philippe that he actually asked me about the types of ambulances, and his recommendation was that he wanted to, quote unquote, get these American-style van ambulances because they're much larger than the ones that have been previously donated. And in one of my recent trips, I remember riding on the ambulance with two of the firefighters, and we went on a call, and we had to resuscitate somebody, and I had to step outside to change my mind. It was so small. So it was my pleasure to give them, to coordinate these ambulances. And in fact, the ambulances that we've donated, I've actually worked in back in Honolulu. So these are ambulances that I know work very well. They're spacious. They're, and in an emergency situation, you really need to be able to move around the back of the ambulance to do a lot of things, to get to your patient, to get your equipment quickly, because time is essential in the back there. So I'm glad you had a good experience.
Thank you. Kabo Waymine.
Yang ni kaya Mr. Talam se hindi ako sal mo kalakal na tumul spoil lagi activities sa lalwik. Malakaya ako alger pa ibo kulong ito ma Mr. Talam if they have anything else to say, kaya Dr. Deber matutong sa.
Chico, could you just make a comment on the comparing the curriculum and training process of the EMT trainees here in Palau to the program at Kapilani Community College? And you might mention about the final exam process and where the questions come from.
Yeah, thank you, Dr. Dever. With the exception of very minute differences, they are basically the identical programs that what we offer in Hawaii. In fact, I just recently graduated 3 EMT programs in Hawaii just this past semester. So I'm officially on vacation right now. And the EMT programs are very robust, and we make them that way in Hawaii for a lot of different reasons, and we figure that would be what is the best fit for Palau. The individuals are hungry, they want to learn more, they want to do more, and so we developed the program to be identical to what we see in Hawaii. And so the training was identical. The only part that we could not do exactly is that we send our students on ambulance ride-alongs because we have so many ambulances. Here, they were already working, so they already had that experience. What we did was we fine-tuned their experience, and we were able to explain to them that not every call they run on requires that they go lights and sirens to the hospital. So they actually perform very good assessments, evaluations, and just because they called 911 does not mean that they have to race them to the hospital. So they've learned a lot of that, which is good. They've learned that how to do proper assessments, how to do vital signs on a regular basis, how to interpret what those vital signs actually mean, and to identify patients who, what we call sick versus not sick, people who are potentially unstable, who require emergency treatment and rapid transport. And almost the pivotal piece is to relay that information as soon as possible to the hospitals. So when they call the hospital in the emergency room and they can explain not only what's been going on, but what they did to help relieve some of their symptoms, the hospital has a better understanding and can properly prepare for delivery of that patient. And speaking to some of the physicians recently when I was here back in October, they've come to me and said that they've heard a tremendous difference in the way they communicate to the hospital nowadays. And it's much more clear, it's more concise, very accurate vital signs, and this helps prepare the hospital, like I said, for delivery of those patients. So we're seeing, great great outcomes. So.
Thank you.
And
Thank
the
you.
final exam process of the EMT program?
Oh yeah, and the final exam process is a two-stage process. The first is a written examination, and the final exam, written exam, is the same exact final exam I give to my students in Honolulu. And once they successfully complete that, they have to test every skill that we offer. There are 10 skills, and those 10 skills they have to perform based upon national standards. So it's the same guidelines that we use in Hawaii. Like we said, we tested them to the same level and capacity, and all 10 skills were done remarkably, and we ensure that they are competent in those skills because, you know, life is precious, and we want to make sure that they're competent in what they can do.
Sel ornya jiwo malwa tabangal sel training laro ngiro belau. Sedia ka mal Dios isiu ngi misel laro ngira Hawaii. Ay ke rogul testing method ma questionnaires ma tela skills al ngar seguidel National Registry. Sel uspe ngi ablo amrige rogir.
Yeah, so Dr. Mekoll, thank you. Currently, we don't have National Registry certification in Palau for a couple of reasons. One is that National Registry has nowhere to test here, and too close. Oh, no. So the questions from, well, I have data banks, test banks, that are harder than the National Registry questions. So with my students back in Honolulu is that if you can pass my final examination, you can pass the National Registry certification easily. And so that's a testament to how well the students do. So if they pass the final examination, they're well prepared, yeah. In terms of National Registry certification locally, they don't have any access out here, and yeah, so it's something we're working on down the road. It's on our to-do list.
Thank you, Chico. Dr. Mekoll mentioned that I'm chairman of the Palau Board of Health Professions, the licensure board. And you can see now when, as Chico said, the curriculum here in Palau for the EMTs was the same as the curriculum at Capilani Community College. The examination process is similar to the examination process at Capilani Community College. In fact, some of the questions are not from the U.S. registry, but are in a question bank that is actually more difficult than the U.S. registry. So it wasn't difficult for the licensure board here in Palau to license the EMTs when we looked at that. And now, why aren't they registered? Well, that's as educational as well as a political question. One of the issues is, and I'll be blunt, if we register them in the U.S., then there'll be an outmigration of very well EMTs to help the poor people of America. All right, so you can see that these EMTs now are national treasures, and they are very valuable to the Republic of Palau, and we don't want to lose them. Thank you.
Thank you, Dr. Deaver. Make sure they get a salary. We need a salary higher.
Ya wase setelah sekitar telek malorang asuli adra PCC. Etigam telek maklo imori retagi del mo olsis akrar mo EMTs el hoy. Lo mentira adra Capilani Community College. Dak malwaisel kaya ako tingilan ate malikluto yang asal Mr. Talams marakol listeners. Ay ka nganya ka newspaper lal ke elalwi ke mga ngigid ko na marawa erkul par ke firm malungit at mo dartin malutang le meuk le weselo yol dorul.